WPSU is your source for Penn State sports, Penn State research, Penn State community. But we can't do it without your support. Make a contribution today and get a DVD of your favorite Penn State show.
Presentation of To the Best of My Knowledge on WPSU is made possible in part by support from the Penn State Alumni Association, informing, involving, and inspiring Penn State alumni and students through its publications, programs, and events. On the web at alumni.psu.edu. And from the members of WPSU.
From the studios of Penn State Public Broadcasting, this is To the Best of My Knowledge. Good evening, I'm Graham Spanier. Tonight we'll talk about the flu. Nationwide, visits to doctors for influenza-like illness have increased and are higher than expected for this time of the year. On average, 36,000 people die from flu-related complications, and more than 200,000 people are hospitalized from flu-related causes each year. Tonight we'll discuss prevention and the treatment for the flu. We'll also take your phone calls at 1-800-543-8242. You can also email your questions to response@psu.edu. And now let's meet our guests. Dr. Thomas Terndrup is a professor and chair of Penn State's Department of Emergency Medicine and Associate Dean for Clinical Research at Penn State's Hershey Medical Center. Betsy Hunt is the District Epidemiology Manager and a nurse epidemiologist for the Pennsylvania Department of Health. Thank you both for being here on our program tonight. I think we're going to get a lot of interesting questions and a lot of interesting calls. And Dr. Terndrup, let me start with you with a very basic question. What is the difference between a flu epidemic and a flu pandemic?
An epidemic would be the caseload being above that which normally would be expected, whereas a pandemic situation would exist whenever there's sustained person-to-person transmission in many different countries simultaneously.
And then how about the difference between a seasonal flu and what is now being called the H1N1 flu?
Seasonal flu is what we commonly know and unfortunately experience at an individual basis each season, typically during the flu season. And the symptoms we probably know well, but worth probably reminding ourselves what those things are: fever, cough, chills, aching, and relatively sudden in onset. Whereas a pandemic situation involves really biology and evolution of viruses seeking out, trying to survive. And so as they evolve, they develop different characteristics that challenges our immunity to viruses that are normally in circulation.
Mm-hmm. And Betsy Hunt, tell us about the H1N1 situation in Pennsylvania right now.
Well, we know that the H1N1 virus is circulating very widespread in the state. If you look on our website, you'll see a number of over 3,500 cases that are confirmed, but this is probably an underestimation because a lot of people are ill and don't seek treatment and are not tested. So we're really looking at trends based on our different surveillance systems, and we know it's widespread activity, flu illness in the state.
Now, I have to think that we've had somewhere in the neighborhood of 1,000 cases at Penn State. We've kind of settled down at about 250 cases a week. Yesterday was our biggest day ever with 77 cases of students having the flu. So the 3,500 would seem to be an underestimate. Now, I know we can't test all 1,000 students. We're making certain assumptions about it, but they have flu-like symptoms. So is the 3,500 in Pennsylvania confirmed cases where you've actually tested their virus, or is that an estimate based on those that you have tested?
That is actually a number of those that have had a test done that confirms that they are infected with H1N1. But as you said, many people are ill, don't seek treatment, aren't tested, so certainly it is really a tremendous underestimation.
So what do we do to prevent pandemics? Looking at this a little more globally before we come back to Pennsylvania and our local situation, looking at it on a worldwide basis, what's going on? What's the phenomenon that's out there that makes this happen?
I think as the H1N1 virus has evolved, it's very infectious. It's easily transmitted, and we have no natural immunity to the virus. So the implications is easily spread. What we can do about it is to try to use really good public health measures, Graham, to reduce the spread, and that means simple things, not coughing out into the public, but coughing into your arm or a handkerchief, careful hand washing. We're much more vigorous in the clinical environment about being cautious about and recommending that to the public. Isolating oneself from the rest of the public when you're sick, when you're able to spread the virus to others, that's during that most infectious period. That's really beneficial, and that also means the workplace. I think some of the strategies that you've communicated to about with Penn State employees, that if you're sick, you should stay home. Many of our employees want to go to work even if they're a little bit ill, but I think during this season in particular, we need to be cautious and recommend to our employees that they stay home if they're sick.
But looking at this on a worldwide basis, we have these pandemics every, 10 to 30 years. Mm-hmm. Can that be prevented, or is it inevitable that somewhere in that span of years you're going to have a pandemic?
I think we really think that it's inevitable, and so the best thing that we can do is plan to be prepared for the pandemic. We hope it isn't severe. We hope it isn't very virulent illness. However, I really think that it is an inevitability, and we need to exercise preparation.
Mm-hmm. And Tom, how do you diagnose the H1N1? Someone comes into the emergency room and they say, I'm sick. What specifically are you looking for to determine that's H1N1 or seasonal flu, or it doesn't matter, they just have the flu?
Right now, what you ended with is what we do. We don't test people unless they're hospitalized or severely ill. We're assuming, since 99% or more of the isolates that have been submitted are positive for H1N1, that there's no point in testing somebody with typical influenza-like illness mm-hmm. for the disease. So we would use that as confirming in cases where there's sort of confusion over the diagnosis, but most of the time it's pretty straightforward.
Now, they have a fever typically?
Yes.
Are they also typically coughing?
They were coughing. Oftentimes they'll have associated gastrointestinal symptoms like vomiting and diarrhea. Mm-hmm. They may have a bad sore throat, headache, chills and aches. Typically onset rather rapidly as compared to the thing that it's most commonly confused with, which is an upper respiratory infection or caused by other types of viruses, where the symptoms are mild and there's a little sniffling and coughing, but it's pretty mild, and you may have it for several days before it even begins to wear on you. Mm-hmm. Whereas this one makes you prostrate pretty quickly.
And with flu, do you have the itchy eyes, the sneezing, the watery nose and eyes, no. Or less of that? Less of that. Mm-hmm. Less of that, and more of the bad symptoms associated with an infection that's just brewing throughout your body, as these viruses tend to do once you're infected. Mm-hmm. I know we're going to have a lot of callers, and we invite you to call and join our discussion. So let's open up the phone lines right now and start with Mary Ann from Allentown. Mary Ann, you're on the air. Hello there, Mary Ann. No? Okay, Mary Ann is not on the line, and maybe she'll call back and we'll get her connected later. How long do you recommend that people remain at home once they do have the flu?
For the general public, we recommend that patients that are ill stay home for 24 hours after their fever resolves and they haven't used fever-reducing medicine. It is different for healthcare workers. We recommend that healthcare workers stay home for 7 days after onset of symptoms or 24 hours after they get better, whichever is longer, because they serve a vulnerable population. But for the most part, for those listening, stay home for 24 hours after your fever goes away and you aren't using fever-reducing medicine.
Well, why longer for healthcare workers? It sounds like you want to be really sure they're over it, but not necessarily for someone else who's ill?
I think it really has to do with their close contact with others that have medical conditions that puts them at higher risk for complications. We want to be sure that the virus is cleared completely from the healthcare worker and they aren't spreading it to the patients that they take care of.
What would you add?
Yes, I think that's exactly right what Betsy said. We certainly wouldn't want to give patient disease. We're trying to diagnose and treat those diseases. So I think the extra effort to those who are directly exposed to patients in particular, those at the bedside, if you will, nurses and doctors and other technical staff, need to be especially worried about transmitting that to people with chronic illness.
Now, we've got a lot of offices on campus where there are big containers of hand sanitizer, and our university health service has passed out these little things you spray. I often keep one in my pocket and spray myself occasionally because I shake, hundreds of hands every day. And I see a lot more hand washing going on, and even people today on the racquetball court were joking after, instead of shaking hands, good game, they're banging their elbows together and doing their knuckles and so on. Does that all really make a difference? How important is that?
I'll start off. It does. It clearly makes a major difference every time we touch a surface or touch some part of an infected individual's body. We may pick up the virus and be able to move it around and transmit it. So washing one's hands especially is an important way to reduce the likelihood of transmitting it to the next person, either indirectly through touching an object that they touch or touching someone directly.
And the alcohol-based hand sanitizers are good if you don't have access to hand washing, running water and soap. Those hand sanitizers work very well. They're good prevention.
I might add as well that we're not particularly good in the healthcare field at washing our hands. Betsy will probably maybe reinforce that message. And we need to be better at doing that, Graham. We're working on that. I must say, in my 30 years of practice, I've seen more hand sanitizers, more people washing their hands, and more vigor over this. I heard a fact earlier today that we've got an immunization rate at Penn State Hershey in the medical community there of almost 75%. Ordinarily would hover around 45% for a typical healthcare environment, and which isn't great at all. But seeing it closer to 75 or even bigger than that would be a real gain. So I think people are paying attention.
Now here's a real self-serving question. I go to a dinner, I'm in a receiving line, or I'm going around during the reception, I'm shaking hundreds of hands, and there's no real opportunity to wash my hands in between, and I didn't bring the hand sanitizer. How long after you've shaken all of these hands are you still at risk? Is there a point at which, it's a half an hour later, no problem, I can't possibly be infected if I now touch my eyes or nose or something, or does it stick with you for a very long time?
Well, the virus can survive on surfaces for at least 2 and up to 8 hours. So certainly it can remain on your hands. And if you don't have the hand sanitizer, you could use strategies so that you aren't using your fingers to eat. You aren't, eating bread perhaps with your fingers, and just using utensils would be a way. Just think about keeping your hands away from your mouth, your nose, your eyes, and that would cut down on transmission.
Another good reason to cut down on my bread eating, I guess. Okay, now we've got to turn to some of the callers here. Thank you all for your patience, for being in the queue. Let's begin with Jamie from the Saucon Valley. Hi, Jamie.
Hi, how are you?
Very good.
I have a question. My son is 5.5 years old, and he was just sort of diagnosed with H1N1. They did not do the blood test, but they are assuming that he has the virus. And my question is, my husband stayed home from work today, but how long should my husband remain home, though he doesn't have the virus but could be a potential carrier?
Your husband shows no symptoms
None.
himself, but you're just being super responsible and wondering whether
Yes.
he should stay at home.
That's correct.
Okay, can I ask how old is your husband?
Oh, gosh, 37.
Oh, okay, because I think there's some age-related issues here from what I've been told. Anyway, what advice would you have for this husband?
So if I understand the question from the caller, it's should my husband stay away from work after being just exposed but without any symptoms? I think the recommendations wouldn't call for anything specific other than monitoring for that individual. You know, it's not 100% likely that someone exposed will get it. So I think in the absence of any symptomology, any symptoms that her husband would have, there wouldn't be any need for him to avoid contact with others or otherwise restrict himself.
Jamie, if you're still with us, does that help you out?
That answered my question. I'm sure it answered my
Send him
husband's
back to
question.
work. No excuse for staying home.
Well, thank you.
The reason I asked about the age question is I understand, I mean, I've been told that because of my age, I'm actually less susceptible to getting this. As you get older, the odds aren't as great because of your life experience being exposed to various viruses. And actually, our college students, for example, are in an age range where they're highly susceptible.
Yes. I could provide some background for that if it would be useful for the audience and yourself. That we believe that there's natural immunity, i.e., for people over the age of approximately 50, we believe that there was similar types of viruses circulating at that time to which you developed an immunity because of exposure, and that may provide some relative protection for those individuals.
Yeah, great. Barbara from Hollidaysburg, you're on the air.
Hello.
Hello, Barbara.
I'm an old retired registered nurse, and I'm just wondering. I've probably heard you have probably said it before, and I missed it. What is the incubation period on this? Do you have any idea?
Well, we didn't specifically answer that question, so it's a good one.
The shortest that it probably could be would be about a day, and it could be as long as a week. And to explain to the other viewers, the incubation period is the time from when you're exposed until the time you develop symptoms, which is important to know because if you feel you were exposed, there's a window where you may not have symptoms quite yet, but you still may be infected and later develop disease.
So it could vary over a period of days, but then we go back to the advice you gave earlier. Wait for, did you say 1 day after the fever has resolved?
Right, 24 hours after the fever. If you become ill, you should stay isolated, stay home, don't go to work, don't go to school for 24 hours after your fever goes away without using fever-reducing medicine.
Okay, thank you. Next is Jack from State College. Go ahead, Jack, with your question.
Yes, I'm a parent of a student at University Park, and I'm just calling to see if there are any plans to vaccinate against the H1N1 up here this fall.
Well, there are indeed. We have just started the process, starting with healthcare workers and people who do work with very young children. But we're anticipating the shipment of vaccine to arrive here within the next couple of weeks, and then we'll be rolling out our vaccination program for our students. You may want to tell us a little more about how this works, not only locally but around the state, because we have viewers from all around Pennsylvania.
Right. Well, the H1N1 vaccine is actually provided by the federal government, purchased and provided by the federal government. And right now, unfortunately, there are limited supplies nationwide. It takes some time for vaccine development, and they started developing the vaccine as soon as they could, but there's just limitations of time for the vaccine development. So right now we have limited supply, but the state did receive some supplies. We received the type of vaccine that's sprayed into the nose, intranasal, and a very, very limited supply of the injection type of vaccine. And we the plan for the state has been, we ask providers, what we call providers, doctors, schools, universities, some VNAs, ask them to sign up as providers, and they went through the process, and several of them have received the vaccine and started to deliver it. In the future, probably later in the year and into 2010, we plan to have mass vaccination clinics that will be provided by the state Department of Health and local departments of health in other parts of the state. And that's to catch up anybody who was not able to get it from their doctor or anybody that couldn't get it from their school. To answer the caller's question about the university, they did receive some vaccine, a very limited supply, and you're right, they did give it to people already with the university, but they, as soon as we're able to get them more vaccine that we get from the government, we'll certainly.
Am I being overly ambitious by thinking it might just be a couple of weeks, or?
It may be, we hope, but it's a very difficult thing because we're being told about this production delay from the vaccine manufacturers. So we hope a couple of weeks.
So the best advice is stay tuned, both within the community, with your healthcare providers, and certainly for those who are waiting for the university to see the vaccines arrive.
And I'll add, Graham, that the university really has done a wonderful job in developing plans. Many years ago, when we started talking about pandemics that we thought we would see from avian influenza, the university really was in the forefront of developing a plan for their students, their faculty, staff, and really have done a wonderful job at planning. Part of the problem right now just is supply of vaccination, and we hope that does get better soon.
Meanwhile, I've had my seasonal flu shot just a few days ago. It took me about 30 seconds, free of charge to our university employees, showing their ID. So we recommend all of you who work for Penn State to do that. Next, we've got Curtis from Spring Mills. Good evening, Curtis.
Hi, good evening, Dr. Spanier. I had a question was related to the previous one. Just on the news tonight, for instance, they mentioned that there were clinics where vaccine went unused, so there seems to be some misallocation of the resources. Is there going to be some sort of website or information of where one can get the vaccine for the H1N1? For instance, I contacted Geisinger today and was advised they weren't going to have the vaccine until late November, and even that was not certain. Also, one other question. I've heard that if one develops symptoms, it might be advisable to have the vaccine done. Is that correct?
Well, let's, Tom, maybe answer that question first. If you develop symptoms, then does it help you to get the vaccine at that point?
Well, I think this is an area of debate, as I understand the CDC, the Center for Disease Control Prevention recommendation, is that you may develop some immunity after you get the flu. If you do get the flu now, you're very, very likely to have H1N1 and not some other influenza. So there is some natural immunity. I think the recommendation is still to go ahead with the vaccine, with the assumption being that you may not have sufficient immunity to protect you.
And what about the question of, is there a one website people can go to?
I think I saw the same news story that the caller alluded to about it was in a different state and there wasn't a high demand, and that's unfortunate. As far as receiving vaccine, what I would advise is if you want to get vaccine, you should first contact your doctor or your child's doctor if you're trying to get your child vaccinated. Ask them if they will be getting the vaccine. Did they sign up as a provider to receive vaccine? If you're looking to get your child vaccinated, ask your child's school. Several schools, many schools in the state, have signed up to be providers and are actually providing vaccine to their student population. If both of those are no, then I would say stay tuned for the mass vaccination clinics that the Department of Health and the local health departments plan to have. And although there aren't any sites listed yet, but you could go to our website, which is www.h1n1npa.com. And when we start to activate those mass vaccination clinics, they will be listed there, locations will be listed, and times will be listed. So
we'll put that on the website associated with this program that I'll mention at the end.
And there's a lot of good, just in general, health information about the disease on that particular website as well.
Very good. Let's turn now to one of our regulars, Walter from Warren. Hello, Walter.
Mr. President, can you hear me?
Yes, I can.
Thank you for taking my call. I'm delighted that you recognize me as a regular, and I have no qualms if you wish to get by this question with a little help from your friends, Drs. Hunt and Waltrip. And, you know, you're the leader of at least the political, social, and moral leader of a large, treasured community in Pennsylvania. I mean, Penn State is a marvel. I mean, it's wonderful. And as such, its close proximity of all those students, they're a tinderbox for H1N1 and all the flu vaccines, as well as meningitis and other communicable diseases. And, you know, you're the leader of this community. Do you have any legal recourse to requiring your faculty and students to get these public health measures? I mean, it'd be delightful if you could say everybody's going to wash their hands after they sneeze, but
well,
you know,
first of all,
that ain't going to happen.
You give me a little more credit than I probably deserve. I'm not sure.
But, you know,
they say that being the president of a university is like being the captain of a ship, where everybody mutinies but nobody jumps ship. So I'm not sure we have nearly that much power and influence, but you
get your students and faculty immunized with meningitis and H1N1 vaccines.
Well, we certainly, some things we require of our students, and we certainly encourage our faculty to get immunized. It's free, as I said, to get the seasonal flu shot. The government is providing the vaccine for the H1N1 when it arrives. But he raises an interesting question about how far should we all go in forcing people or strongly urging them to. And I'm sure it's an issue you face in the medical community, and you undoubtedly have some people who just don't believe in vaccinations and immunizations at all.
Graham, it certainly is a concern, and our current approach is we strongly recommend that all of our employees receive the vaccination. I think the state of New York is the only state, to my knowledge, that has attempted to go farther than that, and that was met with significant resistance in the state of New York. It's you know, we live in a free country, and our ability to make free and independent decisions is fundamental. But and I think we as medical professionals would strongly recommend, based on the evidence, the significant safety and efficacy, the effectiveness of the vaccine, which is why we believe that everyone should have it.
Now, Walter's question ties in very nicely with an email that we got here at response@psu.edu. Last night at the Schwab Auditorium talk by Jean-Michel Cousteau, many people had continuous coughing and sneezing. If such people are not willing to stay home to protect others, should ushers at public events invite them to leave or distribute masks? What does our epidemiologist say, Betsy?
Well, we certainly urge anybody that's ill, don't go out in public, because that is how the virus is spread. Coughing, sneezing, if the person is infected with the influenza virus, then they can spread it to those around them. But you know, as Tom mentioned, for vaccination, we live in a free country, so sometimes it's difficult to legislate that kind of activity and restrictions on people. So my advice is to think about protecting yourself. I actually read an article in a newspaper earlier this week where a physician mentioned moving his seat on the bus 3 times to get away from people that were ill. So, you know, think about yourself, think about protecting yourself, staying away from people that are ill if you can, washing your hands, not touching your eyes, your nose, your mouth, and just practicing good prevention.
We have lots of folks in the queue, and I want to invite you to call in and continue to stick with us and hold. We'll get to as many of your calls as we can. Next with Tierra, who is calling from Kerwinsville. Hello, Tierra.
Hi. Sorry. I was wondering if, how long should you stay out from school when you have H1N1?
Okay. Are you in school, Tierra?
Yes, I attend Kerwinsville Junior Senior High School.
Uh-huh. And a lot of kids out there?
There are a few confirmed cases and a few kids that think they have it but won't go get tested.
Uh-huh. So same answer
Yeah, the
that
same
you gave
answer,
before?
24 hours after resolution of fever without using a fever-reducing medicine. And Tierra, we've worked closely with schools, given schools a lot of information on excluding kids that are ill. So I know school nurses out there are working really hard. Teachers are watching for illness, and we encourage the school to enforce an exclusion policy the 24 hours after a resolution of fever.
Lynn from Devon, you're next on the air with us on To the Best of My Knowledge.
Yes, I've got a question for you, and you might have answered this earlier, so I do apologize.
That's all right.
I have 2 little ones who, in the last 2 weeks, I would believe have come down with the H1N1, and it has come and it has passed. Do they still need to get the vaccine?
Your advice?
Yes, I think the recommendation is still to receive the vaccine, even though the assumption is that some relative immunity has occurred during the actual infection.
Mm-hmm. Is that what the health department is recommending?
I think the
well?
only, person that we would not recommend vaccine for perhaps would be somebody that had definitive testing done to actually know that they had it. And that's sort of tricky because it's a specialized test that is done. It's not just a rapid antigen test that a lot of people have received. So,
but even if you've had it and you get vaccinated, there's no additional harm or risk beyond the minimal risk that anyone would have from a vaccination. Is that right?
That's correct, Graham. And not that we know of. There are some rare complications from vaccination. But again, the strength of the evidence strongly favors the safety and effectiveness. There's a neurological complication called Hambre Syndrome, which can occur, but it's the frequency with which this occurs is very, very small, and it's hard for epidemiologists to tell. Betsy is one that could comment further whether, in fact, the observations that were made previously during the mid-70s were really correctly attributed to the swine vaccine previously, or whether this was just an incidental observation.
If you're just joining us, I'm Graham Spanier, president of Penn State, and this is To the Best of My Knowledge on WPSU, Penn State Public Broadcasting, and on the Pennsylvania Cable Network. Our topic tonight is the flu, with guest Dr. Thomas Terndrup, professor and chair of Penn State's Department of Emergency Medicine at the Penn State Hershey Medical Center, and Betsy Hunt, District Epidemiology Manager and Nurse Epidemiologist for the Pennsylvania Department of Health. You can join the conversation by calling us at 1-800-543-8242 or email us at response@psu.edu. We're going to take some more calls, but let me turn to an email that we have here from Linda saying there have been some doctors who are publicly warning, especially parents, to not get the vaccine for the flu, saying that there's just not enough knowledge of the after effects. She's asking, should parents be concerned more about such vaccine effects? Is there a possibility of their child getting seriously ill or even dying from the vaccine? She has some other questions, but that's a pretty big one right there. How do you address that?
Sure. A couple observations. One, this is a new vaccine, but it's like seasonal influenza vaccine that we produce every year, using essentially the identical methodologies for developing the vaccine. There's no reason for us to believe that there'd be any additional serious side effects with this particular formulation.
With any vaccine, with any medication, there's always this risk-benefit ratio. And
correct.
Would it be fair to say that based on years of experience with these kinds of vaccines, the benefits so far outweigh the risks that you are generally universally recommending it?
We are, and especially for certain populations, this pandemic has really affected a different population than what is usually affected by seasonal flu. And we're seeing a high number of illness in school-age children, college-age kids. There's risk for severe complications for pregnant women. So because of the risk for complications in those groups, we really recommend vaccination. And as Tom mentioned, it is made the same way seasonal flu vaccine is made, and it has a strong safety record. So we know a lot about it.
Mm-hmm. You know, these fast-talking people at the end of some television commercials or in the contraindications that you read about often say, if you're pregnant, don't do this. But in this case, it's just the opposite,
yes.
Right? Pregnant women are especially at risk and should get the vaccine and be careful about what they're exposing themselves to.
That's correct. If I could emphasize that particular point, Graham, pregnant women are, if not the top priority group because of their susceptibility. They're certainly at the very top, and they appear to be more susceptible than other types of other subcategories of people. Mm-hmm. So we strongly recommend that pregnant women received the H1N1 vaccine.
Let's take a call from Dick, who's calling from Johnstown. Thank you for being on our program tonight.
Thank you, Dr. Spanier. Thank you for donating your time to a great, informative, and interesting program.
Thank you.
And your guests as well. Since you're the host, I'll direct this to you. What role do you think the media has in informing the population of this serious epidemic? And you hear on TV that hospitals will turn people away and the number of deaths. And obviously information is important to the population. But is there a harmful effect you see, Dr. Spanier, in over information? And I would ask you to comment on that. Thank you very much.
Well, my own view is that this is such an important health issue in our nation right now because of the thousands and thousands of people who are at risk. And for those who are in certain categories of risk, it could be life-threatening. I mean, overall, from everything I've read, it hasn't been as serious as people were predicting. Of those 1,000 or so Penn State students, only 2 required any hospitalization even, and they were people who had were more at risk of certain complications to begin with. So it hasn't been as serious, but so many people are potentially affected that I think paying attention to it in the media is very important. It's one of the reasons we wanted to do this show in October, right about this time, when we thought it would be very relevant. And it's been in the newspapers almost every day. So I think the media have done a pretty good job of drawing our attention to this one. What do you think?
I would agree, and Tom mentioned the vaccination rates that they're seeing now in their healthcare workers at their facility. That's a tremendous benefit from this information being out in the media. People are interested. Some people certainly it may be over. It may be too much information for them, but I think for the most part, this information has been good. People are being informed, and people now are, seeking vaccination and looking for ways to protect themselves.
I would add to those comments that the media tends to inform, and I think we're informing additional parties tonight, and I appreciate that we're able to do that with this audience and yourselves. I would say that the media, if it goes too far, can heighten a level of alertness to where it does create some panic. We certainly have seen during this particular outbreak, I think, a guard against bringing the level of attention to H1N1 and I think the right amount of attention has been paid to it with the right messages and consistent messaging. So I would preliminarily congratulate the media for really doing an especially good job during a very dynamic outbreak.
Mm-hmm. Let's turn now to Margaret, who's calling from South Hills. Hello, Margaret.
Oh, hello. My question is, once a person is diagnosed with the H1N1, how long should they recover, and also how long are they contagious?
Well, in terms of recovering, I think we've been pretty consistent in saying 1 day, 24 hours after the fever has resolved.
Right.
But on the question of how long are they contagious, same answer?
They're probably contagious, minimally so after that 24 hours after their fever resolves. And that's why we can say you can go back to work after 24 hours of being fever-free. Some people perhaps longer, just because they may be, more infected and have more trouble getting over their infection. I don't know if you want to
Typically, what we would see clinically is 3 to 4 days. People are through the vast majority of the illness unless they have a complication of some sort.
Okay. Our next caller's in New Kensington. Norma, good evening.
Good evening. Thank you very much for such a great program, sir.
Sure.
I'm a grandmother. My daughter was notified today. My granddaughter goes to Allegheny College that she has bronchitis. She's going to go pick her up and bring her home tomorrow. Can this develop into the H1N1 virus?
Okay, so if someone has bronchitis or a cold, does it evolve, or does it make them more susceptible, or is it just a separate deal?
So there's a significant overlap between upper respiratory infection and bronchitis, bronchitis being inflammation in the bronchial tubes. We see a fair number of patients with H1N1 who develop bronchial type symptoms. So in fact, I don't know, but it could be that your granddaughter is demonstrating signs of that at the present. She should be evaluated for that by her physician if she's not able to manage her symptoms at home adequately.
Okay, thank you. Lee from Wilkes-Barre. Good evening, Lee.
Hi. I have a question. I was vaccinated yesterday for the H1N1, and I'm wondering how long after the vaccination are we protected from getting the virus?
Do you mean, well, let's assume she's asking two questions. How long is it before it's effective, it takes, and how long does it protect her for?
I'm hoping you know this.
Well, after you get vaccinated, you usually have a good antibody response. So your body's made antibodies to in this case, H1N1 in about 2 weeks. 10 days to 2 weeks. Usually in a person with a good immune system, they have that kind of antibody response. It's kind of a question as to how long a person is protected. So, if H1N1 is still circulating next year, there may be waning, immunity in you, and we may recommend that you get revaccinated. But there probably would be at least some residual immunity that you would be protected.
So don't go out and party and go around kissing sick people for those first 2 weeks.
Couple of weeks.
It's not as if, I got my shot, now I can do whatever I want.
That's right.
All right. Kathy from Hatboro. Hi, Kathy.
Hi, thank you for taking my question. I am an older person, and I've been trying to get the seasonal vaccine. And my primary doctor, didn't even have it. And I've been today, I went to 3 or 4 different drug places, and they say, no, we do not have it. We don't know when we'll get it in. So I didn't know if you knew, what was happening there with the seasonal vaccine.
Yeah, what do you advise folks? I mean, can anybody go to Hershey and get a shot, or is it more difficult than that?
We have a limited supply of seasonal. We've just begun to receive some H1N1, the nasal mist vaccine. But we have primarily focused on our 8,000 employees as those who I think we hold out the greatest degree of they're on campus. We assume that we will be immunizing them. But our outpatient clinics located throughout central Pennsylvania are also sites where those patients and family members may receive influenza vaccine.
Mm-hmm. But I imagine, as she's saying, that there are some physicians, some practices, they just don't have a supply. What do you do if your particular doctor doesn't have it? How do you find it?
For seasonal vaccine, there actually has been some delay, I think, in doctors and other offices getting seasonal flu vaccine. And my understanding is, the pharmaceutical companies are trying to make both vaccines at the same time. And, because the activity we're seeing, the flu disease we're seeing right now is primarily H1N1, it's been a priority to get out that vaccine. And so I do know that a lot of offices, doctors' offices, have not been able to get their seasonal flu vaccine yet. That doesn't mean it's not coming. It doesn't mean that you might not find community clinics in your community that would offer it. So my advice would be to keep an eye out. If your doctor's office ordered it, it's our understanding that those that have ordered it will be receiving it. It just may not be sooner, it just may be later. If your doctor's office is not getting it, look for community clinics that you can go to get seasonal influenza vaccine.
I might add, Graham, that I think the Commonwealth of Pennsylvania has a great website for H1N1 and flu, but flu.gov for the audience is very easy to remember, www.flu.gov, and there's a wealth of terrific information in there, both for professionals and, if you will, the general public. And I can't say off the top of my head if that information would be there in the caller's particular area, but it may be.
Place to check. Thanks for mentioning that. Our next caller is Carol, who's calling from Cole Township. Hi, Carol. Hi. You're on the air.
Hi. I have a question for the doctor. My daughter is a college student. About 18 months ago, she got a vaccine. It was not a flu vaccine. Had an allergic reaction, and she has developed an autoimmune disease. Now, with this, should she get this new flu shot?
Okay, so thank you for that. I understand the question is your daughter had an autoimmune disease subsequent to receiving an immunization, not the influenza vaccine, is that right?
Right.
Okay. So my guidance would be for her to go directly to her physician, either her specialist if she's seeing somebody who's a specialist in autoimmune disorders, or her primary care physician, and seek guidance on that. I appreciate you bringing up the question because it does involve some complexities. We do know that people who have, for example, egg allergies cannot receive vaccine because they're, the vaccine is made in egg products. So there are reasons not to get the vaccine, not too many, but that would be one where I would advise you to seek guidance from your primary care or your specialist.
One of the questions that is coming in electronically, are there adverse effects from the preservative used for vaccine? Thimerosal, a mercury-based preservative, is mentioned. There have been reports linking its use to other things.
I'll start off, but I think Betsy also needs to comment on this if you don't mind. For many years, there has been debate about autism and the relationship with vaccination, childhood vaccinations primarily, and some people still believe and hold out that that preservative, if you will, is in fact responsible. There's not clear scientific evidence that this is the case, but some people do believe that. There are, as I understand it, and this is where I really need Betsy's help, preparations of the H1N1 vaccine that are free of that particular preservative.
Right. The preservative is used in multi-dose vials, and vials that have more than one dose. So there would need to be a preservative in that. But Tom is correct. The nasal type of vaccine, intranasal vaccine, does not have thimerosal, and the pre-filled syringes that are single-dose syringes do not contain thimerosal.
And there's another question: is it safe to get vaccine if I have an active neurological condition?
Well, this is tied into the whole discussion about Guillain-Barré disease and whether whether people with acute neurological. There's the problem with that, Graham, is that's such a vague term, an acute neurological condition. And I think the explicit guidance would probably be, again, best achieved by consulting with your neurologist, if you have a neuromuscular disorder of some type, to get a firmer recommendation. We're talking to a sort of broader audience.
Mary from Hollidaysburg is next in the queue. Hello, Mary.
Hello there. I had a very bad cold about 2 weeks ago, and when I felt well enough to get to the doctor's, I got there, and she wrote me a prescription. And I have asthma, and I have emphysema also, and I'm 76 years old. So I asked her about this swine flu shot, and she just looked at me and she says, I was too old, and that was that. So I haven't heard this on your program tonight, and it's a very good program you have on.
Well, thank you. Well, we talked about age earlier, and I understand that for someone who's 76, it may not really be a priority at all to have this shot, but then again, maybe you would still recommend it.
The current recommendations would be that individuals of your age are not a priority group. And I know it may not sound great to you, but what we mean by that is that people who are pregnant, other priority groups, healthcare workers, those who are supervised in direct contact with young children, are priority because those are the individuals who we feel have the greatest susceptibility to the disease and can spread disease if they become infected. And the likelihood that you may have some protective immunity because of your age and prior exposure to other flus that are like the H1N1 now may be protective for you. So maybe you could take solace in hearing that, in fact, you actually may have better immunity for this particular H1N1 than your children or if you have grandchildren.
Here's an email from someone who says basically, I think I got this Sunday evening. She's obviously in the midst of it, or maybe it's about ready to resolve, and wants to know, should I go to the doctor now because maybe I'm just going to ride through it and that'll be it? Do I need to go and have it diagnosed? From everything I've heard this evening, it sounds like if she's kind of managing it and getting through it, get through it and get on with her life, she doesn't now need to go and seek medical care. Does that sound like the right advice?
I agree. I think that is the right advice. There are times, though, that you really should think about seeking medical care. If you have symptoms that went away and now came back, if you start having trouble breathing, you should seek medical care. Certainly if you're pregnant, you should seek medical care. Short of that, I don't know if Tom would add anything else, but generally most people do get better without seeing the doctor, going to the emergency room, even without taking antiviral medications, Tamiflu or Valenza. But just be aware of your symptoms and seek care if you start to feel worse.
I would like to add something to that. As an emergency medicine specialist, I can tell you that one thing that we've seen in many cities across the United States is an outpouring of individuals into the emergency department. That is not the right thing for the public to do. If you can manage effectively at home and you don't have difficulty breathing, which sort of boil it down to one thing, likely you're going to be okay. There are some things to worry about like dehydration, but if you can stay home, take something to reduce your fever, to take care of your aches like acetaminophen or Tylenol and ibuprofen, things like Motrin. While we would ask you to avoid aspirin use, plenty of fluids, rest, and usually the disease is going to resolve itself without any intervention. When you go to the emergency department with this disorder, you're exposing other people as well as yourself, if you don't have the disease, to those who might be there waiting for care. And again, in many cases, unnecessarily. So the wrong thing to do would be to run off because you're worried that you have H1N1. Seek guidance from your physician. Stay at home and do those simple recommendations and wait until your fever is resolved for 24 hours before going back out.
Eileen from Phillipsburg, if you're quick, we might be able to squeeze your question in here.
Okay, thank you. My question is, I have a 17-year-old son who has Asperger's, and I'm sure you probably know it's a high-functioning form of autism. A couple of years ago, he had the meningococcal vaccine, and he developed hives within half an hour 15 minutes, half an hour after the vaccine. So I had to rush him to the emergency room. So, I'm worried that he might have a reaction if he gets this vaccine. Is there any way I can find out the maker of it? As far as I know, his doctor's office reported this to the Department of Health, but I'm not positive.
Is there a quick answer to that, Dr. Terndrup?
I'd say check with your physician about that one first.
Mm-hmm. Yeah, that's one that probably not amenable to a real easy, short answer.
Require a little more guidance.
Yeah, we appreciate that. We have been blessed with a huge backlog of email questions and a lot of people in the queue wanting to ask us questions over the year. But our time's going to be over soon. I want to ask each of you if there's any important message on this topic that you would like to give as we begin to wind this up this evening. Tom?
Sure. Grant, first of all, thanks for the opportunity, and I think this is great guidance for the public. It's been a good opportunity for me to not only meet yourself again and Betsy, but to resonate some important messages with the public. I'll just re-emphasize the notion about seeking emergency care when you have a true emergency, and there's no reason that I can think of, just because you think you may have the disorder, to run into the emergency department with something like this.
Final word, Betsy?
I would emphasize, I'm a public health nurse, so I would emphasize prevention. Stay home if you're ill, cover your cough if you're ill, wash your hands, which goes for prevention of flu and many other things.
Thank you to our guest tonight, Dr. Thomas Terndrup, Professor and Chair of Penn State's Department of Emergency Medicine at the Penn State Hershey Medical Center, and Betsy Hunt, District Epidemiology Manager and a Nurse Epidemiologist for the Pennsylvania Department of Health. And thank you for watching. We hope you'll join us again on Tuesday, November 17th, when our topic will be weight loss surgery with Dr. Ann Rogers, Director of the Penn State Surgical Weight Loss Program at the Penn State Hershey Medical Center, and Dr. Jan Ulbrecht, Professor of Biobehavioral Health and Medicine and co-director of Penn State's Institute for Diabetes and Obesity. For all of us here at Penn State Public Broadcasting, good night.
Knowledge on WPSU is made possible in part by support from the Penn State Alumni Association, informing, involving, and inspiring Penn State alumni and students through its publications, programs, and events. On the web at alumni.psu.edu. And from the members of WPSU.
A copy of the program you've just seen can be purchased through Penn State Media Sales at mediasales.psu.edu or by calling 800-770-2111.